Planet Vero Studio is powered by the Nolan Group of RE/MAX Associated Realty. MyNextHomeFinder.com.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soule.
And welcome to Community Conversations. So glad that you're joining us this week, because every week we have great guests, but this is a repeat great guest, which really pleases me a lot. Dr. Pham is a member of our medical staff, and he is such a great teacher. I love talking with him, and I hope that you will gain some knowledge, some additional information out of our conversation today. So Dr. Pham, welcome.
Thank you.
You are a family practice physician who's been with us
for a little bit over a year.
Oh, seems like longer. Your schedule is pretty full, but I heard yesterday that you took a new patient, a friend of mine, and she said, I love him. So I think in large part it was because you're a good listener as well as a good talker. So thank you for the service you give us. So today we're going to talk about physicals and prevention, and maybe a little bit about high blood pressure as well, since that seems to be a lot of our aging population, including myself, at least a consideration as we hear others talk about it. How's that?
Perfect. Good topic.
So annual physicals, why are they so important?
Annual physical, probably that's the most important examination that you need per year. But think of it, medicine evolves so quickly. Knowledge become obsolete and treatment maybe become outdated. So an annual physical examination is a total assessment of your health or reassessment of your health based on our most current clinical practice guideline.
And look at all the time you'll save on Google, right?
Perfect. And you get the right information as well. So the main goal is to provide you with the disease prevention, disease detection, and treatment based on today's evidence-based medicine. I recall my time in the military. All soldiers are required to have the annual physical examination on their birth month.
I didn't know that.
Yeah.
So it's not just fitness for duty the first time around, or it re-up?
No, you have to do it every year. And think of it, you could do the same thing with yourself as well. You don't have to do it in your birth month, but just pick a month that you like and make it a tune-up month. Have your physical examination, have your dental exam, eye examination, and whatever else you need, including immunization or any healthcare maintenance that you require, maybe nail and spas and all that stuff as well if you need.
That's a really good idea. It would help stretch things out. I know for many of us women, it's like September, we get the announcement, coming up to October, breast cancer awareness, blah, blah, blah. And we go, oh man, when was my last mammogram? So if you did it on your birthday, sort of got that annual tune-up, that's a great idea. But what about if you feel really healthy? Why would you spend the time and the money to come in and see someone?
Right. So, it's not just a visit. When you visit a provider, the provider can do a lot of things for you. Think of it, even though the appointment is just for a physical exam, annual physical examination, it might be a new visit or a recurrent visit. What the provider has in mind already is that he or she are going to collect some data from you, either new or updating or reviewing your medical history, your family history, your medication history, any allergy, anything new over the last year or so.
Yeah, because we like to think nothing's changed. I hear that a lot.
Right.
People will come up to our window and they'll say, can I ask you a couple of everything's the same. But it really isn't. It's the same for us because we've gotten used to the new, whether it's a new home or a new medication or a new medical condition or even a dental thing, but it's not new to you. It's not the same.
Yeah, so the provider can not only collect information through question and answer from you, getting history, but also he or she can also do examination, physical examination, to detect if anything new. He can also analyze the data that you're giving him, and this is the most critical part because it's based on your age, your risk factor, and all that stuff, and then he compare it to the clinical practice guideline and provide you with recommendation, either it be a prevention measure such as mammogram or pap smear or colonoscopy or any other type of colorectal cancer screening.
I'm so glad you mentioned that because, again, we are seeing in the literature that rate is increasing because it's affecting younger and younger people. It used to be you didn't need to do a real concerted screen until you were in your 50s, and now that age is coming back down.
Definitely. You're totally correct and very update in that aspect. Finally, the provider can also, while he's talking to you, we come up with a plan. Consider your labs, maybe some radiology, any procedure you need to do, such as maybe a skin biopsy, or maybe he could do a on-the-spot treatment of precancerous lesion. So all can be done at that single visit. Or he can refill or prescribe you new medications, such as for blood pressure, cholesterol, whatever condition that he might find. Or if it's beyond his capability, he can refer you to see specialists for further treatment as well.
So let me ask you about that, because many people rely on specialists, and then they think they don't need to come back to their primary care physician because, well, they got the report and everything is fine. What's your thoughts on that?
My thinking is that even though the primary care provider might not be the expert at everything, but he's the home of your medical care. He's the person who coordinates your care. He's the one person that you can ask question, and if he doesn't know, he'll be able to look up at the information from the specialist, be able to translate into a common term for you to understand. So a primary care play an important role in your healthcare.
Well, I agree with you, which is why you're here, because again, I listen a lot to what people say and the conclusions that they come to and their behaviors and their decision making, and I wanted an expert to have a viewpoint that could be shared instead of just mouthy little me. I do have a question, too, because I'm often asked, well, why do I need to go to my primary care physician? I just had a Medicare visit, okay? It was kind of weird because it was with a nurse. I guess it must have been a nurse practitioner, and I have to say, no, there's a shortcut here to keeping you healthy, as opposed to not doing anything, and that's the Medicare wellness exam.
Right. So Medicare require you to do certain preventive measure. There's shall I say it, a cookbook for doing a certain thing, and I'm saying most of the time I mention a provider. However, what we have to remember, it's a provider team. When you enter a clinic, you have a front desk person, you have an MA who is also part of my team, important member. We also have nurse and other assistant as well. And the nurse visit is part of my team collecting information, and he or she would convey that information to me in a more thorough manner than I could do in a short 20 or 40 minutes visit with my patient.
So you can really focus on important elements that have come out during that time.
Right. Okay. And many times that my team member will be able to remind me of things that I have missed.
So I'm going to forgive you for saying we're a clinic, okay? Because we are a health center. Again, the image of a clinic is that it's, sort of first come, first serve, nobody knows your name, you're just a number, and nothing's certainly further from the truth in our health centers. And so I know you just kind of slipped back, but I need to clarify that because that is still a lot of confusion about the difference between a community health center and private practice.
Right.
And you would be stellar in private practice, but you have aligned with us, and I'm so grateful. So let's talk about some other things besides the annual wellness. And I'm going to go back to my cheat sheet, okay, because you did prime the pump with a couple of great questions. And the one that comes to mind without my even looking is, well, what if you don't agree with your PCP? What if you just think they're wrong, or their advice or the way they communicate just doesn't sync with you? What can they do about that?
Well, so remember, this is your health, and it is you. So you as a patient, you are the driver of this car, and your providers are simply consultant or maybe a co-pilot.
Okay.
For you. So he provides you information, but he does have some privilege of ordering medication or appropriate tests, or he has a little bit more knowledge on you. Mm-hmm. However, he should consult you on what your wish is.
Okay.
And he will provide you with informed and update information on what to do with your health. But you are the one who make decision on your health care.
So it's okay to question and ask for more information before deciding this guy's all wet and I'm going out someplace else.
Right. So I think that a lot of providers, we all are different. We have different personality. So our patient, and sometimes we talk to somebody, we might click them. We kind of bond with them kind of naturally. And you might like them as a person. Maybe that's a perfect provider for you because you entrust him with your health, and you trust him that he make a right decision for you. But if you talk to somebody, some other provider, and you find that we might be disagree on
too many things.
Right. Too many things, including the fruit that I like or the color that of things that I like, then maybe you can choose another provider. There's many other providers around. One of the things I might mention is that a lot of time the physician are very introvert people. And we have a lot of nurse practitioners in TCCH.
We do.
And to me, TCCH employ NP for a purpose because we know that NP have great experience in the past. Previously, they're probably seeing a lot of patients. They do a lot of patient care and work closely with the patient. And when they come provider, they have that great empathy, and then they have very experience with patient care already. When provider, we're probably not trained that way. We're more like a bookworm. So we may have that skill as a NP.
Well, and that's so true because one normally thinks about a nurse, being that warm, loving, empathetic individual, and yet they have been trained slightly different, a lot of experience before they ever come to us. And you guys do consult with each other on patient care things. So to me, that's the best of both worlds.
Correct.
Wonderful. Well, let's take a short break for a word from our sponsors. And when we come back, I'd like to talk about high blood pressure.
I'll be ready.
Okay.
Revive Vero Beach, located next to Anytime Fitness on Oslo Road and 27th Avenue, has everything you need to look and feel your best, including hormone replacement therapy, stem cell therapy, sexual wellness, weight loss, laser aesthetics, hair, tattoo, and skin spot removal, Botox and fillers, cryotherapy, comprehensive blood work, and everybody's favorite, ozone and IV therapy. Refresh, renew, and revitalize yourself at Revive today. Call 772-492-6607. A member of the iTex trading community. Your iTex dollars are welcome.
If you want a home that has the style of the coast, come to Sunshine Furniture during the Tommy Bahama and Lexington half-price spring home event. Now until February 28th, you save 50% on all bedroom, dining room, media, office, and occasional furniture with fresh finishes and rich textures made from materials that reflect the essence of coastal living. At Sunshine Furniture, our 35,000 square foot showroom is also filled with the largest selection of in-stock coastal furniture from Universal, Hooker, Riverside, Four Seasons, and Capri. We are the outdoor furniture experts and have the largest selection of patio furniture anywhere. Visit Sunshine Furniture now during the Tommy Bahama and Lexington half-price spring home event. All pictures, lamps, and accessories are 50% off. Sunshine Furniture, $12.95 US 1 in Vero Beach, next to Planet Fitness. Visit our website at sunshinefurniturecasual.com. Also, don't forget to visit our outlet and sales store just across the street.
The new year is underway, and it's time to schedule your annual physical. This quick, comprehensive visit can uncover diabetes, high blood pressure, and even cancer, ultimately saving your life. Treasure Coast Community Health waives Medicare deductibles and offers a sliding fee scale discount, so everyone can afford to take care of their health. We can't fix what we don't know. Let's work together to make a healthier community. Call us today at 772-257-TCCH. We're a nonprofit. And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health. We provide medical, dental, behavioral health, pharmaceuticals, sort of a one-stop shop in the primary care area so that it's convenient for you and your children, and very comprehensive as well. Our physicians look at the insides of mouths and make recommendations. Our behavioral health people ask about your blood pressure and when was the last time you've seen a PCP, because they're concerned about you from head to toe. And so in that light, today I have Dr. Pham with us. Dr. Pham practices family practice out of our central location, right there at what used to be the Kmart Plaza. I'm not sure what we're supposed to call it now, but in any event, he's talked to us about annual physicals. And one of the things that probably drives people to get their annual physicals is when things change as we age. Suddenly it becomes a little more important. We get a little more pressure from our spouses or our children to find out what's going on. And oftentimes what's behind some of the symptoms that they feel is what they're told is high blood pressure or hypertension. So we need a little more information than that, Dr. Pham. What exactly is hypertension and what causes it?
So hypertension is, by definition, is when your blood pressure measure at least 2 or 3 times that above 120/80.
Okay.
So normal is less than 120/80. If it's above 140/90, it's considered to be stage 2 hypertension. Okay. But if it's between 130 and 139 and over 80 to 89, it's stage 1.
Okay.
And then between stage 1 and the normal would be elevated high blood pressure. There's a blood pressure that is really concerning. It's called hypertensive crisis. It's when your blood pressure is above 180/120. 120.
Those are some pretty big numbers.
It is a big number. And if you have that number, well, seek care soon, especially if you have any other symptom, including chest pain, short of breath, or any change in mental status. Go to the ER right away if you have the numbers higher than 180/20.
And most people are not checking their own blood pressure, so one would assume that they might be getting that advice from whoever is actually taking the blood pressure.
Right. As we mentioned before, annual physical, perfect time, because one of the things that our medical assistant would do is get your history briefly, and then do a vital sign, including check your height and weight, and most importantly, your blood pressure.
But isn't it natural for people to have slight increases in their blood pressure as they age?
It is correct. Over time, your blood pressure might be increased over time because the blood vessel may become hardened over time. The heart may not be function as it is during the younger years. There's many risk factors that can contribute to high blood pressure. As I just mentioned, age, there's family history, there's gender. Male tend to have high blood pressure than female.
Really?
There's race as well. African American tend to have high blood pressure than other population. And then finally, there are people with certain disease that can also cause high blood pressure. As I mentioned before, these are the risk factors that you cannot do anything about. You cannot change your age or gender or your family history. But there are other risk factors that you can change. For example, these can contribute to your blood pressure as well. For example, overweight or obesity, too much alcohol, too much salt, smoking, lack of physical activities.
And I was going to say that too much or too little is sort of subjective, but smoking is an on-off button. All smoking is bad for hypertension, correct?
Well, not only bad for hypertension, but it's also bad for other things.
Yeah.
For your lung, for cancer as well. So I would avoid it at all costs. Other risk factors, including unhealthy diet, energy or sport drink. Some of those has stimulant or lots of caffeine or sugar. It can cause your blood pressure elevation. Other risk factors including obstructive sleep apnea, high cholesterol, diabetes, or stress can also elevate your blood pressure.
So is there, since we're sort of number dependent on how you fall in that range, is there a proper way to take a blood pressure?
Yes, there's a proper way of getting blood pressure before you diagnose yourself as having high blood pressure.
Good point.
Let's verify it first. Let's do it correctly. Okay. So first of all, what you want to do is don't smoke, don't have an argument, don't drink coffee at least like half an hour before the blood pressure taken. Empty your bladder if your bladder is full. Sit and relax with your arm at the heart level.
Don't cross your legs.
Don't cross your legs.
They're always telling me, uncross those ankles.
Right. And then measure your blood pressure. Don't talk while you're doing a blood pressure measurement, and don't take it over clothes. So some of my patients will ask me, hey, is a manual blood pressure better than the machine? To me, they have different advantage because the manual machine is done by professional and it's a little bit more reliable. The automatic machine has an advantage of being repeatable. So because the machine just know one way of doing it and consistently, so it's either always right or always wrong. And if it's already wrong, you can always bring the machine in and to your appointment and compare with the blood pressure taken.
Great idea.
At the clinic at center.
It's okay.
Yes. Some people go to clinic.
I'll keep working on you.
Right.
So the reality is that even within our centers, if someone has a high blood pressure reading from one of our very capable medical assistants, you usually have them repeat it 10 or 15 minutes later. What's the purpose of that? Yes,
it's same exactly like we just mentioned. The purpose of that is let them rest a little bit. And then we measure it more appropriately because a lot of time when a patient walk in and we do blood pressure the right way, of course, they didn't have that time to rest. And also maybe the provider could be therapeutic, make your blood pressure improve after talking to the provider.
That's so true. You're right. I've seen a lot of people, especially first-timers, they're a little uptight, a little anxious. That's got to affect the blood pressure. So if that is slightly elevated, then I would suggest, in the interest of time, that people recognize that another visit is very appropriate, it's very affordable, And an ounce of prevention is worth a pound of cure. So thank you so much for everything you've taught us today. You'll be back. I know you will.
Right. Thank you.
Thank you. And thank you all for staying with us. I hope it has been as enjoyable for you to learn these facts as it has been for me and Dr. Pham, of course. See you next week.